Good afternoon, everyone. Can I begin by expressing my condolences to the friends and families of the 4 people whose COVID-related deaths have been recorded today. Our long pandemic battle sadly continues, and I want to talk today about how we can steadily work our way out of it. But it is a finely balanced conversation, because I want to offer people hope, but to stress the need for caution. Like everyone else, I long for the day when any restrictions, do not hang like a dark cloud over all aspects of our daily lives. That day is achievable, but we have to tread carefully towards it. Vaccination, coupled with strict adherence to social distancing and other good public health guidance, can help us get there. Our vaccination programme is continuing at pace, and as of close of play yesterday, 361,430 vaccinations had been administered. That's more than 16,000 people than the day before. We're making real progress on our over 70s or over 65 to 69-year-olds, and now importantly, our clinically extremely vulnerable patients. 92% of our over 80s and 80% of our 75 to 79-year-old age groups have now been vaccinated. Vaccination is protecting more and more people each day. But alongside this, there are uncertainties and unknowns, and we have to acknowledge them and be frank about them. As the Chief Medical Officer has rightly made clear, some restrictions may be with us into the long term. We may be wearing face coverings in shops and on public transport for a long time to come. That kind of restriction may well become part of our new normal daily life. This is not to say that lockdown or partial lockdown will roll on indefinitely. It doesn't have to be that way, because to be clear, restrictions and lockdowns are not the same thing. If we continue with the progress we are making, we can consider a careful, managed easing of some measures, but only when and if the timing is right. The Executive will next week look at what should be done in March. It will consider what changes, if any, should be and can be made to the current restrictions. And today I would want to set out the 3 guiding principles on how I believe we should proceed. My first is that infection rates must come down and pressures on our hospitals must be significantly eased. That is achievable because we are making important progress towards it. Case numbers have been falling thanks to the efforts and sacrifices that people have made across Northern Ireland. But there is still more to do because our hospitals and our healthcare workers remain under intense pressure. We need to redouble our efforts to stay at home, shop only when necessary, go out only when necessary, don't mix with others unnecessarily, wash your hands and wear our masks. If we want a better spring and summer, we need to make the utmost effort now. By aggressively stamping down on infection rates, we can create more room for manoeuvre, more opportunities to do things differently, more breathing space to start rebuilding our health service, more breathing space to rebuild our economy and our society, and more breathing space in our daily lives. My second guiding principle is that we need to be acutely aware of the risks and uncertainties that come with this virus. Caution should always be our watchword. When it comes to the easing of any restrictions, we have to crawl before we can walk before we can even think about running. If there are to be any changes in the next few weeks or months, they must be introduced gradually and carefully and strictly monitored. New variants represent a considerable uncertainty because we cannot risk a swift and destructive surge of new cases with our health service still reeling from the most recent surge. We cannot walk the public out of one lockdown only to end up falling into another in a small number of weeks. We remember only too well what happened over the Christmas period and how increased mixing led to a huge spike in cases. In the coming weeks, we have St. Patrick's Day and Easter holidays, times when people traditionally met up for socialising and for family time. But we must not let history repeat itself. My third principle is that we must always be very mindful of how tough this all is and the toll that it is taking. Let me be clear. I hate the very word lockdown and all that it represents. I know how fed up everyone is. I feel it too. Believe me, I hate the damage being done to our community, to our economy, to our society and to individual lives. As a father, I very much understand the sacrifices being made by our children and our young people. As a son and a brother, I long for the day when my family and everyone else's family can enjoy the freedoms that we all used to take for granted. But we can get there, but we're not there yet. There is still work to be done, so I ask you, please keep playing your part. Get the vaccine when your time comes. Do everything you can to keep yourself and to keep others safe. That's how we all get through this. It is how we get through this, and we'll get through it together. And I ask the Chief Medical Officer, Dr. Michael Mcbride, to give his contribution.
Thank you, Minister. Good afternoon, everyone. I would just like to add my sincere and deepest condolences to the families and friends of the 4 people who have sadly lost their lives to COVID-19. It's almost a year now since we had our first case of COVID in Northern Ireland, and during that time we have lost many, and we have asked the impossible of so many more. We've had restrictions that pre-COVID none of us could have imagined. Face coverings and social distancing have now become second nature to us, and they are a crucial part in our response to COVID-19. And as the Minister said, I want to thank every single person for the contribution that you have made and the difference that you continue to make. As well as helping a fight against coronavirus, these restrictions have most certainly also had an impact on other viruses that we normally see at this time of year. This winter, as yet, there have been no outbreaks of flu, no outbreaks of norovirus, the winter vomiting bug, and no outbreaks of RSV, the respiratory illness that affects our children so badly each winter and keeps our children's wards and units very busy and a cause of significant concern to parents. This has undoubtedly helped our health service get on with the job at hand, providing the best care that we can for people with COVID and those without. So what now? What happens next? As the Minister has said, we are all fed up. We are all tired. It has been a very long and a very difficult year for all of us. And while some restrictions are likely to be required into the long term, as I have said, that does not mean all of them. No one is advocating for a full lockdown continuing into next year. We can do better than that, and we must do better than that. Vaccines, although highly effective and safe, do not provide perfect protection from infection or from disease, and not everyone will take up the offer of the vaccine, and we will not get 100% population coverage. Now, if restrictions are relaxed in a way that allows R to increase above 1, the numbers of new cases will grow. And if the restrictions are lifted too early or too rapidly, this could lead to large numbers of hospitalisations and deaths unless vaccine coverage is very high. So we need to allow time between relaxing one thing, assessing the impact of that relaxation before we make the decision, the executive makes the decision to relax another thing. Small, careful baby steps. And meanwhile, all of us need to continue doing the things that are working and saving lives. What is needed now is caution and a determination to avoid any false starts or false hope. We also need to be optimistic that things will get better. It is important that we provide a sustainable basis for the careful and gradual easing of the current restrictions down the line and at the right time. That has to involve, as the Minister had said, lower numbers of new cases, a sustained decrease in hospitalisations and pressures on our health service and health service staff, and more people who are at risk of severe disease and death vaccinated and protected, and more people around them vaccinated and protected. As we start to slowly emerge from the dark winter months, we see glimmers of hope. Everyone needs hope. And as I've said many times before, there was a time before COVID, and there will be a time after COVID. There will be a time after the difficult year and months that we have all just lived through. Our vaccine programme is well underway, and with each vaccination, we take tentative steps towards a more normal society. At the same time, the risk posed by new variants has to be taken exceptionally seriously. We need to build back slowly and surely, and that is absolutely key to preventing a further wave, dragging our health service back to the brink. That is key to providing greater certainty to society and to every other sector. So for now, please do not drop your guard. Do not ignore the advice. Do not throw up the head and rush believing this is over, because it's not. There is light at the end of the tunnel. There is hope, and we will get there. But only if we keep looking out for each other, and after all this sacrifice and determination, if we finish this as we started, together. What I'm now going to do is to take you through a few short slides just to summarise the epidemic as it is in Northern Ireland at present. The first slide shows the 7-day rolling average in new cases per day. And what we can see here is over the last week, the blue line, the new cases have continued to decrease, including in the over 60s, which we know puts the greatest pressure in that age category on those requiring hospital care. The numbers over the last week have dropped from 545 to 438, and that's down to the efforts that you are making and the difference that you are making. We also, in terms of new cases, that is reflected in the test positivity rate, which has fallen from 8%, fallen to 8% from some 13% last week. That is, however, still above the WHO recommendation of test positivity rate below 5%. This is the 7-day rolling average of tests per thousand of the population, which demonstrates that the fall in test positivity from 13% to 8% is a reflection of less community transmission, and it is not a reflection of fewer people being tested. The change across the common travel area, there are significant fluctuations, and these changes do occur rapidly, but this shows the sustained fall across England, Ireland, Northern Ireland, Scotland and Wales in the blue bars. And as we can see, Northern Ireland currently has a higher incidence than Scotland, Wales or the Republic of Ireland, and a lower incidence per thousand of the population as compared to England. This represents the number of positive hospital inpatients. This is the total number of inpatients, and as we can see, still is at a significant level, a higher level now than it has been in any of the previous waves. It is likely that we're going to see the numbers of admissions remain at high levels for some number of weeks, given how severely ill these individuals are and the care and treatment that they require. However, we are seeing a continued fall in the number of new positive COVID patients requiring admission into hospital, which again is a good sign and reflects your efforts in reducing transmission of the virus in the community. We can still see significant pressures on our intensive care. We have seen a levelling out in terms of the numbers in intensive care, but they remain stable at an extremely high level. There is perhaps a suggestion that that is falling. However, the R number for ICU admissions is still above 1, and that number of patients is likely to fluctuate for some considerable time. Thank you, Minister.
Okay, thank you, Michael. Tara McLaughlin, Cool FM.
Yes, good afternoon, gentlemen. My first question is for the Chief Medical Officer, Dr. Mcbride. I wanted to ask you about comments that you made yesterday when you said that it would be 2022 before life returned to relative normality, and also that we would need at least 70% of the population to be vaccinated before easing the restrictions. There has been some criticism. Hospitality have said it's caused some uncertainty and people have felt quite demoralised or despondent. Firstly, what's the health basis for the 70 to 80%? Is that not more of a herd immunity argument? And secondly, do you regret those comments or do you wish to clarify them at all?
I mean, obviously, I think I gave a 1-hour press briefing yesterday, and I think what was being reported is selective highlights from that rather than the interview in its totality, and there's always a risk associated with that. I mean, what I will always do is give a complete, full and accurate assessment of where I think the pandemic is and the risks in terms of the relaxation of the current restrictions. What I did say, and just to clarify, was that would be unrealistic to think that there would not be a requirement for some restrictions during the course of this year. What I did say was that I was optimistic that over the summer that it could be more like last summer, but that as we moved into autumn and winter, that it was likely we were to require some additional restrictions as we've required this winter. However, as we vaccinate more people and we protect more people at risk, then the risk of severe disease, the pressures on our health service will significantly begin to reduce. But again, I come back to the figures that I've given before, which is that until we vaccinate all of those in the first JCVI priority groups, that's everyone over the age of 50, those who are clinically extremely vulnerable, those adults with underlying health conditions, we will still see significant pressures on our health service. That cohort of people is responsible for some 98% of deaths. That's why it's so important that we vaccinate them first. And they're also responsible for 80% of the admissions into hospital. So that's why we need a very, very high percentage of those people vaccinated, more people around them vaccinated, so that actually we can look forward to a time when we have fewer restrictions. In terms of next year, this virus doesn't disappear. It is likely that we'll have to change the vaccines. It is also likely that the vaccines alone will not hold this virus completely in check, and depending on the time of year, that we will require some restrictions to a greater or lesser extent. That is just stating the obvious, and that is stating what we know about this virus and what we've learnt about this virus over the past year.
And in terms of giving people some hope, then you mentioned there that hospital admissions are, down. Are they past their peak, and are we seeing the vaccine starting to kick in? We have had some early reports from Israel of effectiveness.
I think at the present time, I think we are certainly through the peak of hospital admissions. I think we have a little time to go before I'd be confident in that the trend in ICU admissions is downwards. I think there are three things contributing to that. I think there's the efforts of everybody out there in terms of, as Minister said, following the advice. There's the restrictions that we currently have in place, which are undoubtedly contributing to reducing community transmission. And yes, there's the vaccination programme, which has made a very solid start, continues to be rolled out, is protecting people who are at greatest risk. And we are beginning to see the early signs of that in terms of the impact on our care homes, in terms of numbers of outbreaks. It's very difficult at this stage to disentangle which is down to the vaccination and which is down to the falling community transmission. And I am optimistic that we will continue to see downward pressures and reducing pressures on health services. But what I would say is the situation is still very fragile. If we relax the current restrictions too rapidly, too early, or if we don't continue to follow all the advice that we've been adhering to over the last year, then we could very quickly see a resurgence in cases with all of the associated consequences.
Tara, maybe just to clarify one of your points as well in regards to hospital admissions. Yes, we are seeing a decrease in the number of inpatients, but let's remember that started from a very high point with nearly 1,000 COVID inpatients towards the end of last year. We have decreased now, as of today, I think there's 544. But let's remember at the peak of the first wave, it was 322. So we're still far and above what was the height of our wave in the first peak. So 1 in 6 of our hospital beds is currently taken up by a COVID inpatient. That's over 500 beds that we can't utilise for other patients as well. So we always need to put, I think, that decrease that we're currently seeing, quite welcome, into perspective as well, because it does bring additional pressures on our health service as well. So, Sharon O'Neill, UTV.
Okay, using my surname, what have I done?
just making sure the right Sharon. Yeah.
Minister, some restrictions could stay, the likes of masks on transport, until next year. I mean, we're talking 2 years into this. I mean, it's a very long time.
It is a long time, Sharon, but let's remember we started from this time last year with a virus that nobody knew anything about. We're seeing new variants develop across the world in different regions, almost now on a weekly, if not a daily basis. So where the trajectory of this virus goes is still within our hands, and I think that's one thing I do want to be clear about today. So the restrictions that will be in place, could be in place, are there because of the measures that we need to take. Those restrictions work by people adhering to them. Those restrictions work by people following what we're asking for them. Those restrictions actually work by people observing, the good hand hygiene, good respiratory hygiene. I think the Chief Medical Officer has already made clear, 0 incidents or no flu outbreaks this year, especially even in our care homes. That's due to the practices that we've put in to combat COVID, but they've been necessary to combat COVID. So there will be, let's be under no illusion, this virus will not disappear as quickly as it appeared. I know there was some speculation this time last year that it would do that, it would burn itself out. That's not going to happen, so that's why we need to put those measures, those guides into place until we see the full beneficial impact of our vaccination programme, which is making good progress.
But the bottom line is, I was out and about today. I mean, a year on, even those who have made the ultimate sacrifices in this are absolutely fed up. It's human nature. What would you say to those people who have done their bit or being asked to do a bit more?
And it is about that, Sharon. It is about asking people to do that bit more because of the hope that the vaccines bring, the hope that we can see by the measures that we have taken. They are hard asks, and I don't think we've ever shied away, either myself as Minister or the Chief Medical Officer, from his professional view, that the things that we are asking people to do are hard to do. They're a change in life and a change of experience that the people in Northern Ireland have made large sacrifices in doing that, but be under no illusion. And I say to the people in Northern Ireland, be under no illusion that the steps they have taken, the precautions that they take on a daily basis, does save lives. Does take pressure off our health service, because we've seen during this recent period of restrictions, we've seen the number of positive cases decrease, we've seen the number of people entering our hospitals decrease, we've seen the number of deaths decrease. So for those people who are following that guidance, I'll say to them, thank you, because you are doing the right thing and you're doing it for the right reason. So please stick with us. Okay. Sharon, have you a follow-up there? No. Marie Louise, BBC.
Good afternoon, everyone. Minister, the public can't be faulted for wanting to know when things are going to start reopening again. And with so many different sectors in the mix, including education, hospitality industry, close contact services, when you're advising the executive next week, what will your advice be on how that reopening should be prioritised? Which sector should be thinking about opening first?
Mary-Louise, I think you'll know me well enough, and I think anybody has known me well enough at these conferences. I never preempt or pre-announce any guidance or advice that I'll be given to the executive. But one thing I think that the executive did when it came out of the initial lockdown was to take that staged, managed approach. I think we have to do that cautiously. I think we have to do it in a managed way as well, always taking into consideration as to where the virus is going and how it's behaving. So when you look back to what the executive did collaboratively coming out of the first lockdown, it was about a staged approach depending on where the virus was. We didn't set dates, we didn't set timetables. We saw how the spread of the virus was going. I can say now that will be the advice and guidance that we'll be giving the executive. Let's not get hung up on dates. Let's concentrate on where the benefits and the reactions of the steps that we're taking is actually being seen across society, and that is by following the three principles that I laid out earlier on in regards to the decrease in community transmission, and the pressures actually easing on our hospital system as well, but also taking into consideration the pressures that it does have on society and family life as well.
Dr. Mcbride, today you've offered some clarity around your comments yesterday when you said that restrictions would stay in place for perhaps another year, and today you've said that some restrictions will stay in place, and that small word "some" does make actually a big difference. Just to give the public a little bit more hope tonight than what they had last night, you said that some things would be different in the summertime. Can you give us just some examples? Give us something to look forward to. For instance, we were able to eat outside last year. We met in larger groups in gardens and parks. What type of things? And if you can give us examples, might we be able to look forward to perhaps at the end of April, May time?
I mean, I look back to last summer and, I know we were all very busy and there were lots of restrictions in place, but I too look forward, as the Minister has said, to spending more time outdoors, more time meeting up with families and friends. I think the important point here is that we're dealing with a global pandemic. We will not be all of us safe until everyone's safe and until this pandemic is controlled globally. And for the next significant number of months and perhaps a year or so, we're going to see epidemics. So depending on how effective countries have been in terms of their response to the virus and rollout of vaccines, we will see significant outbreaks in other countries. Eventually then here, the virus will become endemic. So like seasonal flu, it'll be something that we live with. And in thinking about how we live with this virus, it will very much depend on how quickly, as the Minister said, we suppress the replication of the virus, because that will control mutation. That will keep the vaccines effective. It will depend on how quickly we respond, develop new vaccines if the virus does mutate and escape from being controlled by the old vaccines. And then we need to think about how we adapt our lives. And you're absolutely correct. We all know that activity outside is safer than activity indoors. There's more opportunity for us to come together outdoors and meet up outdoors, whether that's as family grouping or as friends. And I too look forward to the opportunity for more recreation, more physical activity, all of the things that are good for our mental health, but also for our physical mental health and well-being, which have been so damaged over the last year, and particularly by these restrictions. And I have no doubt that the Executive will want to consider those sorts of activity which have lower risk, where the risk can be managed, but are actually still very good for all of our mental health and well-being, and for broader society, and many of those also for the economy. There are other things which obviously carry with it greater risk, and that's why it's important that in considering all of this, that we don't move too rapidly or too early to lift restrictions. But equally, we need to recognise that we cannot live in a situation, as I said yesterday, reiterate today, of permanent lockdown. There will be some limitations. There will be a need for some restrictions to a greater or lesser extent. Some of that will maybe mean applying those towards the autumn and winter when we know these viruses transmit more rapidly, and hopefully during spring and summer we can ease those. So I look forward, as the Minister said, to a spring and summer where more of us can come together and we can meet up again with family and friends, because we all recognise it's been a really tough year for everyone.
Michael McHugh, PA.
Hi, Minister. It's interesting from your comments and those of the Chief Medical Officer over the last couple of days. You're using expressions like baby steps and caution being the watchword. Is anything really going to change in the middle of March, whenever whenever the current restrictions come to an end or are reviewed?
Well, Michael, that review will be had and taken by the executive next week. We'll put in our feed in our input and our recommendations as we always do, but it's about taking those steps that are proportionate and just in regards to where the virus is and what additional stresses and strains there are on society, on the economy and family life as well. So it is about taking that finely balanced approach, as the executive has always done, but it also has to be done in cognizance of the pressures that are still on our health service. If we were to open up too rapidly, too quick, we only compound those strains and stresses that our health services are currently facing. So it has to be done, and any decision has to be taken with that in mind as well.
And secondly, I know that we're talking today about the pressures that I think one of your sister departments are under. Can you maybe outline a bit some of the problems that vacancies have provided during the pandemic, and give me some idea of what the impact has had on your civil servants?
Michael, thanks for that question, because I think one of the groups that has often been forgotten during this pandemic are the civil servants, who have been keeping many of our parts of machinery of government running. And as Minister, I would like to take this opportunity to personally thank and pay tribute to all the civil service, especially working in the Department of Health, because they've put in a tremendous effort and a tremendous number of hours since this pandemic first appeared on our shores. To put things into perspective, my private office alone over the past year has dealt with over 18,000 pieces of correspondence, of assembly questions, of official letters, of general mail, invitations, or executive business. So that's 18,000 pieces of business that has come through my private office alone. In comparison, the last Minister in post dealt with just over 6,000 in the same period of time. My press office have dealt with over 4,000 media inquiries in the year 2020 compared to 900 in the year 2019. So it's an extreme increase of workload, especially felt within my department, because we have bore the brunt of this pandemic in response to reactions, to guidance to the executive, to advice to the general public, and to a general impact of how the virus is affecting the people of Northern Ireland, but also managing the response as well. So I want to take this opportunity to thank my staff across the entirety of the Department of Health, because something that is often forgotten as well of the other departments across Northern Ireland, the Department of Health is actually one of the smaller ones, with only roughly 450 civil servants in post. It may sound like a lot, but when you take into the remit and the gambit of everything that the Department of Health and my civil servants actually cover, it's an increasing workload. It's a massive workload that has seen, in my opinion, a professionalism and a dedication that far goes beyond what we should expect of civil servants. And I want to thank them and pay tribute to them, because they have been under extreme pressure, and the staff has been under extreme pressure with little or no additional resource provided, while we actually managed a significant increase of workload over that period of time as well. Okay, thank you.
Thank you very much.